I think we got through our introductions. I'm Tina and this is Colette. We are both licensed Indiana navigators with Connecting Kids to Coverage. I think what I was trying to impart on everybody is that we'll do our best to answer questions that have anything to do with legal issues. We may in fact just tell you you need to contact an immigration attorney. We know what we know with regard to this topic with getting people enrolled for coverage, but as far as other things, let's just say if you have real specific questions, we'll take those one at a time. But I do hope you do ask us some questions. This is just our disclaimer, our funding statement that we are required to show you per our funding from the Centers for Medicare and Medicaid Services. And then today's learning objectives are pretty simple. We want you to try to get a better understanding of where Indiana's immigrant and refugee populations come from, and also to understand the health coverage options available to non-citizens in Indiana. We want to help describe the different ways all Hoosiers, including immigrants and refugees, can access navigation assistance for completing the application for health coverage. And we also want you to understand that translation services exist to help those for whom English is not their first language. Frequently, people think, oh, well, I don't speak English, I can't get any assistance. Well, that's not true. There are a lot of support systems available, and we utilize one of them, and we'll talk more about that later. And then also, know where free and low-cost healthcare options are available in general throughout the state of Indiana. Here's a little bit about our funding. We are actually, we have what's called a cooperative agreement with the Centers for Medicare and Medicaid Services, and we are one of 39 grantees throughout the country, and this award was the first time it's ever been given to the Indiana Rural Health Association. We're about midway through our 3-year funding cycle, so we will apply for our 3rd year's extension later this summer, and that will take us to June 30th, 2022. And we have some basic program goals that we need to meet, including raising awareness about health coverage available under CHIP and Medicaid, which is what we're doing here today, creating opportunities for families to get their eligible children and teens signed up for coverage, and really importantly is to motivate parents to not only enroll their children and teens, but to keep their coverage renewed. And that's sometimes a bit of a process. If people move around a lot, then the state of Indiana can't find them. But as navigators, we can help keep track of those people and those families and make sure that their coverage stays consistent. And then we also have a lot of outreach guides and toolkits that we can provide people. Then we use those a lot when we're doing our community outreach in general. So I want to give you a little bit of background of health coverage in Indiana. This is kind of a contextual view. Indiana expanded Medicaid in 2015, which was wonderful. And when I talk about HIP, the Healthy Indiana Plan, I'm talking about Medicaid expansion in Indiana. It is a Medicaid product. And then the other clarification I want to make, and I should have done this earlier, is when I say CHIP, that's the Children's Health Insurance Program. It's called Hoosier Healthwise in Indiana. So I'll use those interchangeably, but if you need me to clarify anything, just let me know. Healthcare in Indiana, in addition to having sometimes trouble accessing health coverage, sometimes it's hard to find a healthcare provider. And this map, I like it because it shows very clearly all of those counties in red are known as primary healthcare professional shortage areas. And that means there aren't enough primary care providers, whether they're physicians or nurse practitioners or physician assistants. And so people struggle to find a good provider in many parts of Indiana. And when you throw that on top of the fact that they may not have adequate health coverage, it's an even bigger barrier for those families. And this map, similar to the other one, it shows Indiana's uninsured rates for the non-elderly by age. So there's a category, excuse me, of Medicaid called traditional Medicaid, and that's for the aged, blind, and disabled. And so this is everybody else. This is that category that falls into that age group of 19 to 64 that our Medicaid expansion covers now. And just wanted you to get a sense of how we look in comparison to the rest of the country. So Indiana, for the non-elderly, the children rate, that's 7.1%. That's how many children who are eligible for coverage in Indiana who do not have it. And I found these numbers to be really interesting. This is some information that I got from the American Immigration Council. These numbers are a few years old, but I liked it because it gave a different perspective of what immigration looks like in Indiana. So for example, in 2017, nearly 5% of Indiana's population were immigrants. And of those, 38% are naturalized U.S. citizens. That's a lot higher. Oops. Someone needs to mute. And then in 2017, those who were asked, 75% said they speak English well or very well. You can dig more into this slide and the next ones I'm going to show, but I thought the numbers were interesting and gave a nice context for what immigration looks like in Indiana. Immigrants contribute $1.6 billion in federal taxes and $702 million in state and local taxes. And they combine $5.8 billion in total spending power. And many are self-employed and have their own businesses. And that's a really strong piece to consider as well. And then in Indiana, these are the top countries of origin for immigrants to our state. And these numbers are from 2018. This list is by no means inclusive. We know that there are other countries whose people are coming to Indiana, specifically the Haitian population. We see a lot of them. Also from the Congo and Somalia, we've seen them as well. And with this, I'm going to turn it over to Colette to talk about what navigators typically see in Indiana.
Yeah, so as a licensed navigator here in Indiana, we do see a lot of non-US citizens, but they also have their lawful permanent resident card. And so after they've been here for 5 years, they are eligible for that full Medicaid. We also see a lot of refugees and asylees and individuals from Cuba and Haiti. And along with that, these are all of the different categories that non-US citizens can qualify for assistance. We will not touch on all these today, but we just kind of wanted to give you a general overview of the different type of individuals that we do see and help on a daily basis.
Correct. And you'll notice like on this slide and in our bibliography, I put where you can find this information. I pulled this straight from the Indiana Family and Social Services Administration Medicaid Policy Manual. It's got a really good section on immigrants and non-citizens and what they qualify for. And with that, I'm going to turn it back over to Colette because we have a lot of, oh no, I'm doing these, aren't I? The frequently asked questions?
Yeah.
Okay, sorry, it's my turn. We talked about this. So anyhow, I want to give you an idea on some of the questions that we get on a daily basis as licensed Indiana navigators. So for example, what is a navigator? And essentially, we are here to help you. We are licensed by the Indiana Department of Insurance. We can help you complete the application, and we follow your application status. As I mentioned earlier, we can remind you if missing documents still need to upload it or upcoming due dates that you should expect to prepare for. And we do all of these things completely free because we are funded through this cooperative agreement from CMS.
And also to mention, if you can't get to the DFR office, we are happy to help turn in those documents for you.
Exactly. What if I don't speak English? Most navigators, and we are following this category, most navigators have interpretation services available. Either they're on site with bilingual staff, or we can do three-way calls with a language line service, and that's what we do with our program. And we so far have really enjoyed working with them. They've been very reliable and helpful, and they've helped us an awful lot. So we hope people know that if they don't speak English, they can contact us. And our language line service company, I think, can help us in over 40 different languages. Mm-hmm. So as an immigrant, do I qualify for coverage? Immigrants with that qualified immigrant status that Colette showed you earlier, that list of different qualified immigrant status categories, They qualify for full Medicaid if they are a lawful permanent resident after 5 years, or Package E, which is emergency services only. Package E includes labor and delivery for pregnant women. And keeping in mind that when someone shows up to an emergency room, they can't be denied care. And so this is typically where we see Package E come into play, is a lot of people will show up at the emergency room. What if I'm not sure of my status? Well, as stated earlier, we're not attorneys, but we can work with you to ascertain your eligibility for health coverage, if nothing else. And then we've got some slides later in our presentation that actually have some organizations with their contact information for legal assistance on a higher level than what we can provide. How do I apply? The application for health coverage in Indiana is online. And if you don't have a computer, that's okay. That's where we can step in to help you. We can have you on the telephone and you can tell us your information and we enter it into the form. We can do it through a HIPAA secure Zoom account that we have. And as things start to open up a little bit more and we can start doing more face-to-face interaction, we can meet you in person, depending on where you live. And is this, we turn it over?
Yeah, so this is what the website looks like for where you would go and apply for your assistance. You would just go and click on the apply for health coverage and answer all the questions that you can under the application. So again, if you do not have a computer and can get to that website, you can also always contact us and we are more than happy to help. We know what questions need to be answered on those applications. And then you can also call the DFR office, the Division of Family Resources, which there is one located in every county. But you can also call the 1-800 number, or you can go to your local county office in person and apply there. So when you apply for your health coverage, you will need the names and date of birth of everybody in the household. You will also need the Social Security numbers for those applying in the household. Now, if you do not have a Social Security number, that is okay. We would just have to let them know that you do not have a Social Security number and that you will only be applying for emergency services only. And the next thing that they always ask for is for your income. So if you get income from any job or really any income at all, you want to calculate that income before taxes for the whole entire month for 30 days. And then there's just some other unearned income that they like to be notified of as well. Especially right now with the unemployment, you do need to turn your unemployment in. And then lastly, one thing the application also does ask for is how you're related, and then also your tax information. So these right here are just a couple different supporting, what we like to call supporting documents that you can turn in to prove your identity and prove that what your income is. So I won't go through all of these, but I mean, some of them are pretty generic. We do like to ask for a driver's license to be turned in. Proof of U.S. citizenship would be a birth certificate. But if you do not have a birth certificate or any documents proving your U.S. citizenship, we do suggest down there at the bottom where it states the proof of immigration status, anything that you can get in document-wise for your immigration status, we always suggest turning that in. And then for a proof of income, they really like to see at least 30 days, and sometimes they will even ask for a full 90 days of income. So there's a couple different ways that you can turn the supporting documents in. As Tina had stated earlier, we are more than happy to help you get these supporting documents in, because when they do send you a letter in the mail, you have 10 days from that date to get those documents in. And if you do work a 9-to-5 job, it might be difficult getting those in. So you can always contact us, and we are more than happy to help you get those documents in the timely manner so you do not get denied and have to reapply. But if you feel comfortable and have time to do it by yourself, you can always fax them in, you can mail them in, or you can hand carry them in to the local DFR office. So from when you first apply until you do get approved or denied, it can take anywhere from 45 to 90 days. But it could also take less. If you have all your documents, you get them turned in right away, that's the sooner that you can be approved. You can check your status online or by the phone, and you just want to always make sure that you have a case number ready and you know what your case number is, so then they can answer your questions for you. So what I always like to tell my clients is that as soon as you apply, make sure you are checking your mail. That is how they will notify you of any documents that you need or if you have been approved or denied. So if you are not a person to check your mail every day, as soon as you apply, you will need to become a person that checks your mail every day, because you do not want to miss that 10-day time frame of when you need to get your documents in, because then the whole process would have to start all over. Oh, and if you move, you want to make sure that you let DFR know of your new address, because they will continue sending mail to your old address and you will not be getting it, any of your mail. But the good thing, again, about us navigators is that we can become your authorized representative, so we will be getting the same mail as you. So if you do move and you forget to call the DFR office to change your address, we will still get those letters in the mail, and we can give you a call saying, hey, did you get this? And then we can kind of help you navigate that Medicaid world to where we can help you get your address changed and make sure you start getting all your documents.
Yeah, FSSA uses the U.S. mail to communicate with its members. They do not use cell phones. They will not call you. They will not send you a text message. So you need to become a strong user of U.S. mail, as Colette was saying. Don't ignore it.
So your age and health determine the status of your coverage, not health of pre-existing conditions though. But what we mostly see is that we work with Hoosier Healthwise, which is birth up to the age of 19 and some pregnant women. But then we also have the Healthy Indiana Plan, also known as HIP, which is the 19 to 64 age range, again, also with some pregnant women. The pregnant women category gets a little confusing to which one you fall under, so that's why we say some there. And then you also have the traditional Medicaid, which is for the aged, blind, and disabled. So that's where that health status comes in. And so as we had stated earlier, what counts as an emergency? So this is for those individuals who do not have their U.S. citizenship or are not quite at that 5-year mark of becoming a lawful permanent resident. So emergency means, under the Indiana Medicaid policy, is a serious jeopardy to your health, a serious impairment to bodily functions, or serious dysfunction of a bodily organ or part. And if your symptoms do not meet those criteria, staff are not required to treat you. They can still treat you in the emergency room though. You will just be billed the full price for those services. So here is just a brief overview of how the Healthy Indiana Plan works. Again, it's for Indiana residents only, 19 to 64. So right now with the public health emergency, they are not taking small monthly contributions based on income, but as soon as that public health emergency is lifted, they will be taking those power account payments, I'm sorry. And with the HIP Plus, they offer dental, vision, chiropractic, and all physical primary physician services. And they do not require any copay or prescriptions for co-pays for prescriptions or doctor's visits, sorry. And under the HIP Plus, members can choose either Anthem, CareSource, MDYs, or MHS. And with each of these programs, there's different rewards and wellness choices that they can choose.
And I will add that Indiana's health coverage programs, as you can see by this list, are very comprehensive. It's not easy coverage to get, but once you get it, it's some of the best health insurance you'll find. So we encourage people not to give up too easily and to work with a navigator, because that's why we're here. We can help you get through those hard parts of the initial application and then making sure you stay renewed so that you can maintain this outstanding coverage.
Yes, great point. Thank you.
You're welcome.
So here is the monthly eligible income guidelines, and these will change. So don't focus on these too much. Just know that they will change to meet what would it be, the new household income guideline.
That's okay. They'll change with the poverty level.
There we go. That's
how the federal government adjusts the federal poverty level. And these numbers change generally every March 1st. So these numbers are what we have to go with right now. And it'll probably be mid to late April before we know what the new numbers are. But until we know what they are, this is what we go by.
That is true. And so just kind of, if you're wondering, if you will, I mean, just kind of look at it, maybe increase it just a tiny bit. But for right now, this is what we do focus on. And so for Hoosier Health-wise, there's Package A and Package C. Package A is for children up to the age of 19 and pregnant women. And Package C is also up to the age of 19. Now, if you notice, there are two different household income federal poverty levels for this. And they do, so if you have more of a higher income, you could qualify under the Package C program. And so here are the income guidelines. Again, this is the same as they were for HIP. They will be changing on March 1st. But as you can see, we have pregnant women Package A and children Package A. The difference between those two are that the pregnant women, and as you can see, family size is not actable under the pregnant women, and that is because if a pregnant woman gets approved for Package A, she is automatically a family size of 2, her and her unborn child. And then we have the Package A and the Package C for the children. And as you can see, as I stated in the last slide, the Package C income is a little bit higher than the Package A. You would just have to pay a monthly contribution like you do for HIP.
We like to remind people when we're doing outreach like this that these income levels, particularly for Package C, are really very generous. And this is another place where people automatically assume that they don't qualify for state coverage. Maybe they applied for HIP and got denied, and so they assume that their children are also going to get denied. That's not the case. It could very well be that they make enough money, but can still qualify for this coverage under the income guidelines, which these will also change as of March 1st. Okay, I'm back on. So, as Colette alluded to earlier, if you are enrolled in an Indiana health coverage program when the pandemic hit, you will not be rolled off. But what if you were laid off during the public health emergency? What if your employer had to either furlough you or let you go? As with anything, your address change or any other information about you personally, report all these changes of income to the DFR. And then after the public health emergency is lifted, again, just make it a habit. Watch your mail and be ready with the required documents. Right now, the public health emergency is set to expire in April. But we also know that the acting secretary of HHS, Health and Human Services, sent a letter to all of the governors in the country saying that it's likely or a high chance that the public health emergency will be extended until the end of 2021. We are currently waiting to see if that happens. But unless and until they lift that public health emergency, you just kind of stay where you're at. You still need to report your changes to the DFR, but you will not be rolled off of your health coverage unless the public health emergency ends, and then you'll have to go through the renewal process. So Colette mentioned something like called an MCE, and that stands for Managed Care Entity. It's just an insurance company. And if you are enrolled in HIP, Hoosier HealthWise, or Hoosier Care Connect, which is another program we're not going to really talk about here today because we don't deal a lot with it, you will need to choose an MCE. So currently, those are Anthem, CareSource, MDWise, and another company called Managed Health Services, which we always refer to as MHS. What if you are denied coverage? Well, you or your authorized representative, that would be us, your navigator, we may file an appeal for what's called an adverse benefit determination. Timing, again, is of critical importance. You must submit this appeal within 33 calendar days of receiving a denial. That's very different from 33 business days. So it actually reduces your amount of time that you have to submit this. You can submit your appeal by phone, in writing, by fax, or by email. This is one of the few times they will take something by email. And then healthcare options, we wanted to give these to you. Are you doing this one? Okay, I'm sorry. We had these all mapped out. So you have a lot of options to get your healthcare in Indiana, even though I showed that map that said that we don't have as many healthcare providers for primary care as we would like. And if you're having trouble finding a way to pay for your health coverage, you have some options. So verify your coverage options through your employer. Maybe they have gotten to a point where they can offer some sort of employer-sponsored coverage and they can help you out. Your local county hospital and also some local clinics have low-cost sliding fee scales. And one of those options particularly is an FQHC, which stands for a Federally Qualified Health Center. These are located a lot of times in rural areas. They provide outstanding care. Everything from you can see the doctor for a sore throat. Many of them offer dental services and vision services. Some of them even have chiropractic. So I would highly recommend that you explore if there are any FQHCs in your area. And I'm going to show you a link later in the slides where you can do that. County health departments are also a really good resource, especially for childhood immunizations. They can offer them for very, very low cost. Your township trustee is also available to provide assistance if you qualify. And then you might also just ask your healthcare provider for options on how you can pay for your care. And you may have heard recently of something called, that just opened, called a Marketplace SEP, which stands for Special Enrollment Period. This was just authorized by President Biden, and he did this in response to the public health emergency. Normally, you can only enroll in marketplace options at a designated enrollment time from November 1st to December 15th every year. Well, that just happened, and we still have people who need health coverage, and they may be overqualified for an Indiana healthcare program. This is where the Marketplace SEP is really great for you because it's an excellent option, mainly because if your income is in this certain category, you may be overqualified for state health coverage, but you could qualify for a tax credit with a marketplace option. We have certified marketplace application counselors on our team. They've been trained. They've actually gone through a certification process with healthcare.gov, with CMS, so we can help you with the Marketplace SEP as well. And I think this is in place February 15th through May 15th. So it just opened not even 2 weeks ago. And then here are places where you can find licensed Indiana navigators. Obviously with us, we're the second one down, Connecting Kids to Coverage. You can contact us. Covering Kids and Families is another network within the state, and they work with agencies around the state to have navigators available to their communities. And this HRSA FQHCs, this is the one I was talking about just a minute ago. If you go to this URL, you type in your zip code, and it'll pop up a list of the FQHCs that are nearby. And again, this is an excellent option for healthcare. And then there's a company called ClaimAid. They frequently have, they staff navigators in various hospitals around the state. So you may already know of them. And if your local hospital offers navigation services, it may very well be with a ClaimAid navigator. So these are four different places where you can find a licensed Indiana navigator to help you.
So as again we said, we are not attorneys. We did not go to law school, but these are a couple different resources and legal assistance programs that could help you determine your immigration status here in Indiana. So there is a Indiana Legal Services, and right below them are the different office contact numbers for around the state. There is Neighborhood Christian Legal Clinic with their information there, and then Catholic Charities of Indianapolis. And then we actually just recently partnered with these two, so La Plaza and El Domingo Centro de, sorry.
This is called El Amigo.
So there you go. I wish I spoke Spanish better, but I don't. Those are just two that we recently added to our resource list.
Right. And I will say, if I didn't say it earlier, these slides will be made available to you, and then also this is being recorded, so you can go back through and look for this information again if we've gone too quickly past it. And at this point, we're happy to take any questions if anyone has any.
So we actually haven't had any come in the chat or the Q&A function yet, but happy to open up. There's also a hand raise function. If anybody would like to ask questions verbally, we can do that as well. Or certainly feel free to use the chat function or the Q&A function now to type in your questions. We can certainly hang on the line just a moment. A ton of great information in there, probably people still processing.
Yeah.
I know a lot of new information for me, definitely.
And I'll show my email.
A minute here.
Oh, okay, I'll show my email at the end in another slide. So if people think of questions after the fact, feel free to send them to me and we'll do our best. So Allie, maybe while they're thinking of questions, I've got a few more slides we'd like to go over.
Yeah, actually, I will let you guys go ahead and continue with your presentation, but we have one of our attendees, Cherish Rubel or Rebel. She's one of the people that does outreach for MDYs.
Oh.
And her email address is cruble@mdwise.org. She covers 12 counties, and I'm assuming it's a she, but they do outreach for 12 counties. So if anyone needs information, they have offered their email address as well for information. So thank you, Cherish, for giving your information out there as well. Again, that's cruble@mdwise.org.
That's great. I'm glad, Cherish, that you put your contact information out there. I should have said earlier, the managed care entities have outstanding information on their websites as well. And because they have professional marketing people who know how to message things to a wide audience, it's a lot easier to read and understand than what the Indiana FSSA policy manual says. It's not nearly as legalistic, and it's very clear and concise. We frequently go to the managed care entity sites to make sure that what we're saying is what they're saying, because we know they do a great job. Okay, I'll go ahead and just finish our slides, and then we'll hang on a little bit at the end if we still have questions. I wanted to let people know, if you want to learn more, not only about our program, we've recorded several podcasts and webinars like this rather, and they are at our website, which I've provided here. We have one specifically about pregnancy and how we partner for health coverage, and then we also have an FAQ area where we've created a document that actually is a sister document to this presentation, which has a little bit more information in it if you want to dig deeper. And you can find the FAQ documents at our useful links tab on our website.
Yes, we did that so people did not have to dig deeper into the policy manual. We did all the hard work for you.
Exactly. And were you going to do this
No,
one?
you go ahead.
Okay. And then I just wanted to say a little bit about the Indiana Rural Health Association, where we are housed and where we live. It's a member-driven nonprofit organization, and we work with people all over the state of Indiana, whether you live in an urban or rural area of the state. We have a lot to offer people on a wide variety of levels and topics, and I encourage you, if you want to learn more, to go to the IRHA website there on the slide. And then here is the slide that has my contact information on it. I'm at tdarling@indianarha.org. Please feel free to reach out to me after this presentation if you have any additional questions. If you would like any of us on our team to come talk to your group or organization, we would love to. We can do it virtually, obviously, and as things open up and we feel safe to do so, we'll look forward to doing more in-person presentations as well. And with that, I'll say thank you, and we're happy to answer more questions.
Okay, anybody else have any questions, comments, anything else for the good of the group? All right, Carolyn, I'll let you go ahead and stop the recording. We'll hang on the line for just a moment longer if any other questions come in.